Hi, everyone. It's KMC. In this Help Desk episode, I wanted to talk a little bit about what we call core relationship management. Those that are members will know that we have some excellent training in our library about these topics, and we've kind of divided it into the clinical relationship and the financial relationship. And the premise here is that in the first month of care, it can be the very most important time for the patient to become not only familiar with your office, but also feel that they become a part of your practice community. They always say that you kick off on the right foot, you're going to be in really good shape, usually for the remainder of that relationship. So what we've done is breaking that down into 6 different parts, a clinical and a financial for each. And what happens on the first day, both clinically and financially. What happens on what we call day 1.5 between that first visit and the report of findings and financial report of findings visit, and how important that is. What happens at the report of findings and financial report of findings. And then it goes on from there. Whether you do some type of a health talk that patients are included with, whatever that might look like. But how we sort of spread these to-dos across the first month of the patient's experience. And the big takeaway here is that it is so much easier to keep the patients that you have rather than to have to go out and invest in new patients all the time. Of course, you want fresh kind of blood coming into the practice, and you want new and fresh patients coming in. But really, I remember when I was a Girl Scout a million years ago, they would say, make new friends, but keep the old. One is silver, the other is gold. So have new patients, but keep your existing patients because they are indeed both silver and gold. And why I say that's important is that, when we think about keeping more cash by keeping more patients, really what that boils down to is the conversations and how we are educating the patient, making sure that they understand their obligations, both clinically and financially. Across time, we see that sometimes when patients don't understand their finances, or no one has ever explained that to them, when they're confused, they just go away. And that is certainly not what you want, because that patient retention is such an important piece of your practice statistics and of your practice, really the lifeblood of your practice. So when talking about finances with patients, the best practice is to begin right on visit 1, helping them to understand even before that, on that initial phone call, what they can expect to pay on the initial visit. Just came back from an on-site visit recently where the practice does pay at the time of service every single time, kind of a scenario. Actually, several recent on-site visits are all the same way. And that's never been my reality. I've always worked in practices where payment plans were put into place and patients had card on file in a PCI compliant way, and everything just flowed. We're pre-scheduled and prepaid, or if not prepaid, we definitely had a scenario where the payment was coming in, every month until that balance was 0. And what I found most often when patients are frustrated or concerned about the finances, it's because there were surprises. They didn't know, they didn't understand. And we don't want that to happen. So a key element in patient retention is making sure that in that first month of care, there's good communication along the way. And also that the patients have a very clear understanding of their financial responsibility and what that looks like and how your practice deals with those finances. Remember, make new friends, but keep the old. One is silver and one is gold.